And as COVID-19 cases continue to rise in Missouri, we're checking in with MU Healthcare on how the fight against this pandemic is going. We're joined now live by Dr. Mark Wakefield. Good morning.
Good morning to you.
Good morning. Thanks so much for being with us. Let's jump right in. The state, of course, as we were just talking about, has eased up some of those restrictions. How has MU Healthcare prepared for a possible surge of cases now?
So we're hopeful that there won't be a surge because of our effective previous social distancing. And we're preparing for any possible increases that might happen, however. Always want to be ready with a more stringent requirement for mask utilization. We're anticipating as people go out more in the community that there's a chance that they'll have an increased risk of exposure, and we want to protect our staff and our patients as we too increase the amount of work that we're doing.
Okay. And the number of cases a little bit closer to home here in Boone County has slowed pretty dramatically recently. However, at MU Healthcare, you do have more patients with COVID-19 right now than you did about 3 weeks ago. Could you explain why that is?
Sure, and that is correct. We've had very few community Boone County cases, but MU Healthcare does have more inpatients. And there's two reasons for that. One is patients are transferred to us for the expert care that we can provide in the intensive care unit. And the other is some patients who get very sick from COVID-19 stay in the hospital for a long time. So they accumulate, their dwell is a long time, and so before they can be discharged, it's likely that we'll have an increased census of patients.
Are you maybe keeping more patients longer so that you know that they're going to be okay instead of sending them home, or is there just you're seeing an increase in patients that need to stay there longer?
So we don't keep them any longer than they need to be. As soon as they're safe to discharge, they're allowed and encouraged to leave the hospital. But those patients that are very sick, for example, on a ventilator, may be here for a couple of weeks, and if they're not discharged, they accumulate in the hospital, and that increases our patient census.
Okay. And talking about PPE, which you had just mentioned, of course, there's that nationwide shortage. How are you guys preserving masks and helping maybe other local agencies preserve their PPE as well?
So we have a very effective system to preserve masks, which are a very critical resource, and we can sterilize and reuse those as long as they're not physically damaged. We have a technique to do that, and that's been widely disseminated across the United States. We've also changed how we use some of our PPE. For example, we have learners at MU Healthcare, but we're asking them not to utilize disposable PPE so that we have enough contingency PPE if there's a surge or a second wave or any one of the things that people are worried about. We want to be prepared.
We're joined now by Dr. Mark Wakefield. Good morning.
Good morning.
And we talked last week about MU Healthcare starting to let more clinic visits and to schedule those. Has there been an increase, and how has that been going?
There has been a slow increase, and I think it's been going pretty well. We've always been seeing a few patients who needed to be seen for routine procedures that they have on a scheduled basis or for urgent evaluations. But we're slowly increasing the number of patients seen in the clinic, and scheduled surgeries are starting to increase. But we want to really go slowly and learn and make sure that we're not putting either employees or patients at risk.
And I also wanted to ask, why does it concern people in the medical community that visits to the emergency room or visits to the clinic have essentially fallen off because of COVID-19?
Yeah, I think we have about half the number of normal visits to the emergency room. And, we see this in other pandemics or crises, and people neglect to get care that can really be life-saving or improve their recovery time because they're afraid to go to the emergency department. And that's, it's a very safe place. They've taken a lot of precautions. They've segregated patients that are suspicious for having COVID. And you don't want to die from something that could be treated like a heart attack or a stroke. In my profession, we've still seen a fair number of kidney stones, but maybe not as many as we normally would. And so, you don't need to suffer needlessly with kidney stones, and sometimes you can get really sick from that. So if you need to go to the emergency room, you should do it and feel comfortable that it's safe.
Okay. And we know MU Healthcare's next steps that we talked about were allowing some more elective procedures, making sure people were coming into the clinics. What is MU Healthcare's next steps for reopening?
Well, for the clinics and the hospital in general, because of the increased lack of social distancing, we're going to require people to wear a mask. You know, there's some uncertainty about whether that's helpful or not, but having a consistent policy and allows more interaction with more comfort, I think that will be the next step. And then we'll continuously reevaluate, and if there's not an increased number, then we'll feel that it's safe and comfortable to increase to a greater degree of capacity. We're also considering things like longer hours so that waiting rooms are less congested. But those are going to be determined as this plays out over the next 3 to 4 weeks.
Okay. Dr. Wakefield, thank you so much. We'll check back in with you coming up here in just about 15 minutes. We do appreciate your time as well. And how have telehealth efforts been going for MU Healthcare?
So it's been pretty amazing. We went from essentially doing a couple of hundred telehealth visits a month to almost 1,000 a day. But there have been some challenges. One of the tricky things is some of our patients who are rural or don't have good broadband access have had a lot of technical difficulties. And so that's why it's important to have physical access to the clinics and hospital increase in the near future.
What about those patients in maybe some rural areas who don't have great access to internet? How has this pandemic kind of showed the effects of that?
Well, I mean, there was already a lot of interest in improving broadband access to rural Missouri,